Hi, I'm Dr. Aftab Ahmad. I'm Senior Consultant Physician and Diabetologist, Apollo Hospital, Secunderabad. Today I'm going to talk about the importance of lipid profile in patients with diabetes. You would often see that patients with diabetes come to our clinics with a test which is called as lipid profile test, and it usually contains the LDL cholesterol levels, triglycerides and HDL levels, and they often want to know whether their lipids are abnormal, whether they need to take any medications, whether it is going to cause any problem to them in future. So what is this lipid profile test, and what are the components of lipid profile test, and how should we interpret it? So we should know that patients with diabetes often have high cholesterol levels, and these high cholesterol levels can also cause heart disease in them. In fact, patients with diabetes are at higher risk of developing heart disease when they also have high cholesterol levels. So it's very important that we control the diabetes as well as also manage the other risk factors like high cholesterol levels, blood pressure, and if they are smokers, we also tell them to quit smoking. Now, when we interpret the lipid profile test in these patients, what we see is the LDL cholesterol, which is often called as bad cholesterol. The LDL cholesterol in patients with diabetes should be less than 70 milligrams. So it should be less than 70 milligrams. And if a diabetic patient also has other risk factors, like he's also having hypertension, obesity, or he previously also had some heart disease, or he underwent an angioplasty or a bypass surgery, we should keep the LDL cholesterol less than 55 milligrams. So these are the targets for LDL cholesterol. And there is also another form of fat which is called as triglycerides. So we usually aim to keep the triglyceride levels below 150 milligrams per deciliter in patients with diabetes. So these are the targets for lipid control in patients with diabetes. And to do this, your doctor would advise you, apart from the low fat diet and regular exercise, he would advise you certain medications. These medications are called as statin therapy or statin drugs, and the aim of these drugs is to reduce the LDL cholesterol. They also reduce the triglyceride levels to some extent. Now, most of the time, these medications are prescribed for long term or usually lifelong. This is a common question that is asked by the patients also. Should we take these medications for short term or for long term? So it is important that these drugs should be taken on a regular basis and for long term to have an effective control of LDL cholesterol and to maintain those levels for a long time within the desirable target level. So once we start these patients on these drugs, which are called as statins, so we do check their LDL cholesterol periodically to see whether the patient is achieving the target levels or not. So it's very important that next time you take your lipid profile test and see the doctor, you follow the doctor's advice diligently and see that you are on a low fat diet and you are exercising regularly and you are also taking the medications as prescribed by the doctor, and then periodically checking your cholesterol levels as well to see that you are within the target range. So this is very important, that just sugar control is not enough in diabetic patients. You need to also control the cholesterol levels, you need to also control the blood pressure in these patients, and you also need to maintain your weight within the desirable levels so as to reduce the risk of heart disease in the future.